Joining us on the hotline here is from Akron Children's is Dr. Joe Congeni, sports medicine. And I got to start out before we get to some sports medicine. We just noticed this came across yesterday, and we had the owner, Petey the Pony, had passed away. Did you have any experiences meeting Petey?
I only bumped into Petey in the hallways a couple times, Tony, but I didn't have much direct experience with Petey the Pony. But the kids love the animals, the doggy brigade that we have now and stuff like that. The kids on the floor love that and loved Petey the Pony, too. That's
excellent. Yeah, Petey lived to be 25, passed away yesterday. Yes, from Akron Children's, Dr. Joe here on the show. And let's start out with the Browns over the weekend. You have Deshaun Kaiser, rookie quarterback, in his second game. All of a sudden gets knocked out of the game. They say it's a migraine.
Yeah.
He's been having them since high school, gets them, he says, twice a year. It just so happened to flare up. Yet he was put back in the game. What did you think about that decision, and talk about playing with a migraine?
Yeah, Tony, that is exactly the direction I wanted to go. Just two things I wanted to touch on today, and that was the first one. The Deshaun Kaiser thing, of course, as we say all the time with Ray, I wasn't there. I wasn't assessing him. But do you think, my goodness, how common migraine is in a pediatric population? So in junior high school age kids at a hospital like ours, we have a very, very, very robust migraine clinic. I went down to the migraine clinic to talk to some of the doctors and nurse practitioners yesterday about the prevention aspect, knowing I was going to speak about it on the radio today. So as far as the decision of putting him back in, we didn't assess him, but it is one of the hardest things we have to do. We talk about that a lot. And on the sidelines, trying to assess the difference between somebody who has a known headache disorder and somebody who has a concussion, with number one symptom, the most common symptom we get with concussions being headache, you would imagine it's very difficult on us. So we rely very heavily on the examination, and you could see that the team doctors and trainers took the time with Kaiser to make that evaluation. Now, what made it a little bit easier retrospectively, what we found out after the game, Tony, is that Deshaun Kaiser has a past medical history fairly extensively of having migraine headaches. And so in people that have a family medical history or a past medical history, and they have a pattern of how their migraines come on, and they say this is exactly fitting the pattern of what I've had in the past with migraines, that helps a little bit. But still, you have to do your due diligence and rule out that it could be a concussion. So one of the things with Kaiser is he had a past medical history, and the big question that everybody like you would be asking right now is, what do we do to prevent it from coming back again? How do we know that when the Browns get good again, which is going to happen here someday, we're in a big game, a playoff game, a game to make the playoffs, and he has migraines again? How do you try to prevent these things? And I was very interested in the press conference yesterday. Kaiser gave an answer that was right out of our migraine clinic. So somebody schooled him very well, and I'll go over the 4 or 5 things. Number one is regular sleep habits, making sure you're sleeping well. Number 2 is good diet, and he obviously talks about being well-schooled in the dietary things that can help with prevention of migraines. Number 3, there are some supplements like magnesium and vitamin B2, and there's preventative medicines, depending on how frequently people get these. So with all our kids in our clinic that play sports, which is many, if they're getting them fairly regularly, we have them on preventative meds. But meds have side effects and other issues, so if they are not getting them very frequently, we don't use preventative meds. And it was interesting, they didn't mention in any of the press conferences I saw whether he's going to be on preventative meds or not. The 4th thing is reducing stress, and that's a difficult one. Here's a guy who's in the NFL now, playing NFL quarterback, all the questions, all the issues, all the stressors that go with that. How are we going to reduce the stress in a professional quarterback? That's not easy. And the 5th one is trying to prevent what are called traumatic headaches, and you know that a quarterback in the NFL is going to take some hits. So those last 2 are a little bit more difficult, but those are the 5 things, Tony, that we go over with kids in our clinic that are migraine kids that want to play sports.
Dr. Joe Congeni from Akron Children's here on the show, and I noticed this on the sidelines when they said Deshaun Kaiser's out with a migraine. He's not. He's wearing a hat, first of all, and it was on backwards, so it's not like he was protecting the sun. And he was out there in the bright sunshine, no sunglasses. And I know, at least from my experience of having migraines, I don't want to be outside. I don't want lights on. I want to be in the dark. I want anything I can. And it was kind of strange. And I'm like, he either knows how to deal with migraines or there's something else going on. So those 5 steps seem to. And, I mean, if he's had a history of these, he must know how to treat these.
Yeah, he does. And one of the things, unfortunately, Tony, in talking to our docs in our migraine clinic at Children's and dealing with patients and athletes that I've had that have had them, everybody's is a little bit different. It's like concussion. It's not the exact same pattern. So your pattern of what you get numbness or tingling or you get, the throbbing and you have light sensitivity or noise sensitivity, everybody's a little different with their migraines, too. So I agree with you totally. It seemed like he was really well schooled in his. He's had them before. That probably helped a little with the evaluation on the sidelines that this wasn't his first one. And you could imagine how difficult it would be if somebody had never had these before, trying to assess kids in sports medicine on the sidelines as to the difference of a new migraine headache versus a concussion versus a kid like him who seems to know what his pattern of migraines are like and knows what to do to deal with them.
What's the other thing you wanted to bring up?
The other thing I wanted to bring up is the amazing opportunity that I've had to be on the sidelines for the Holy War, and this Friday night is the Hoban St. V game, and it's quite a spectacle. And when you see these young kids, Tony, it's really something, the look in their eye. Now, here's the link to the Kaiser story. You talk about stressors and anxiety in the locker room before the game. Would this bring on? So it does bring on a series of symptoms, and we'll get some kids who have had migraines who haven't had them in a while or other kinds of headaches or other anxiety-related issues. And so this game, these kids are just so hyped up and very anxious on the sidelines. And then it kicks off, and then all of a sudden you see these high school kids playing at another level than they've played before. And it amazes you about sport how great these young high school athletes do in dealing with some of the stressors and the bright lights of playing in this game. This is my 25th game being on the sidelines for the Holy War, and it's just amazing how the kids deal with that and what a great job they do. And it's part of what makes sports fun is that you see kids learning a lot of their life's lessons for later on in their life in playing a game like the Holy War.